morning, guys. Welcome to Pioneer Advanced Hair Transplant Center. Today, we are going to discuss about an interesting video. That's when do we need second session? So most of the guys had doubt on this topic, that when does we go for a second session of transplant. So there are a few general scenarios where we need second session. But today's patient actually, when do we need second session? Why do we need second session with certain amount of gap, and what are the reasons? We are going to stuck to this patient where what are the reasons that provoke or kind of stipulated reasons to do second session, why certain amount of time gap. So kindly watch the video to understand when do we need the second session of transplant and why. Well, on a general note, whoever has class 4, class 5, class 6 baldness, that means large bald area, would always need a second session, and generally. The second thing is someone has a large scalp would need a second session. And if you guys having a kind of a diffuse pattern hair loss, they also need second session. And guys, class 2, class 3 baldness guys who are expecting more density also would need a second session of transplantation. That's the general scenario where we consider doing the second session of transplant. Well, when talking about the planning of second session of transplantation to this particular patient, we had two reasons. Number one was large bald area, that's class 6, early class 6 baldness, definitely needs second session. Second reason was this man had a kind of average donor density, would always made us to think about doing second session. These are the two reasons in this patient we planned second session. But why second session should be done only after a minimum time gap of 6 months or later? Because we did the second session for this patient after 2 years, but minimum gap is supposed to be 6 months, not next day or not within 1 or 2 months. Reasons are, number one reason is we cannot harvest all the grafts. If you do so, we're going to damage the donor, and future you will not get any hair. And of course, you can ask me a question: how can we get a graft which is not available first time? How can we get second time? So, well, we're going to, when the skin is healed better after 6 months, we can still harvest good grafts without damaging the homogeneity. In the sense, uniform. We still maintain the uniform balanced donor, and we can harvest still few more grafts. That's the idea. Second reason is, imagine if you implant all the grafts in one session, when you don't get a chance to correct it during the second session. In the sense, second session always we can improve the density, and we can add additional few grafts in between the gaps wherever you want it. That is another thing. And the third one is when we target a few grafts, and definitely we can concentrate a more priority area, which are the area most important for this patient. We can prioritize that way and get more density first time. Second time can be additional. Probably a few patients will satisfy to one session, they may not even need second session. These are the few reasons why we need to keep second session only minimum gap of 6 months or later. Well, when you're talking about this is to be only for considered for scalp grafts. Of course, if you really want to get it done beard graft, that can be done next day itself. We are talking about these scalp grafts here. These are the few important reasons one should consider doing second session only after 6 months or later. Well, when we talk about the first session, how did it happen to this patient is, we planned such a way that we have taken little higher hairline, because we already know that there are no good amount of grafts available in one session. So we always short of having grafts. So we made such a way that took little higher hairline and implanted more in the hairline as well as the mid scalp, very little in the crown portion, so that you should get at least minimum good look, good results within one session. So I'm sure he would need second session, but still the plan has to be like this. When someone look at him first session, after first session results, he's supposed to look definitely a lot better than before. That gives a confidence for patient as well as the doctor too. Then second session can be planned. If we implant all these grafts, whatever harvested within one session, and spread it everywhere, I'm sure it doesn't look good at all. That is the reason we need to find out the best area, prioritize area for him so that minimal look he would get it with the first session itself. That's the plan we're going to implement. That's the thing we did for him. If you can see the results, first session is kind of amazing. I'm sure crown area we did not touch it, and still there is a large gaps are found in the crown area. In the mid scalp also density is less. Now that can be filled in second session. So here, since we have taken little higher hairline, we could achieve best density in the mid scalp. This patient, if you want second session, definitely we can bring the hairline down. That's the idea in our mind before planning the first session itself. Well, if you can notice the donor after the first session harvestation, within safe donor limit, we harvested the grafts. If you can see the donor area, it still looks very good. That means we're going to get a few more grafts in second session. Well, here, if you can harvest all the grafts in one session, donor might have been damaged and probably we can't plan second session to him. Now, we maintained a well-balanced donor where second session is quite possible and still we can get the good amount of the graft that can be implanted and utilized in two manners, two ways. One is going to implant in the crown area. Other one is we're going to add in the gaps of first results and we're going to again extend down the hairline. All this can be possible and can be done in second session. That's the reason we're going to plan the second session after a couple of minimum gap of 6 months. If you can notice, the first time results are excellent. It served its purpose, and that's the vision we had before planning a transplantation for him. Now we're planning for the second session. Of course, any time gap between 6 to 7 months, we can do second session. Well, this patient underwent second session after 2 years. So, because his own reasons, during second session again, we implanted more grafts in the crown. Patient didn't want any hairline extension down. He always wanted the same hairline with more density, and he always wanted more density in the crown and mid scalp also. Well, the plan was we implanted more density in the frontal area wherever the first transplant has been done. In between, we made a few more grafts to get good density. Mid scalp, we added more density. Crown again, we added reasonably good density. We didn't want to add more density in the crown because we want to get more density in the front as well as the mid scalp. So here, important number of the grafts being utilized for the mid scalp and front itself. Very few in the crown area we implanted. With that reason, so you would get best density in the front and mid scalp, reasonably good in the crown. That's the idea. If you can see the results after second session results, kind of amazing density in the front and mid scalp, reasonably very good density in the crown. We achieved it. Well, if you want more density in the crown, you can still opt for the third session that can be from the scalp or the beard, whatever it is he wants. But well, when you talk about this beard session, can be done next immediate day also. So that's the important point to be noted. Well, here, if you can observe the donor area again, beautifully we maintained it. That's called the donor management, and that's called a balanced donor. I think we can get a little more graft from scalp itself. That is only possible with the hands of best surgeon and best plan. So, well, this patient, because we planned in 2 sessions with a time gap, minimum time gap, we achieved best results without damaging his donor. And that is the whole idea for doing a transplantation, scalp to scalp, minimum gap of 6 months to perform 2 sessions and still achieve best outcome. Still, we have the manageable donor left in the back, which is very good to know. And this is going to be happen with kind of a big vision in your mind and plan accordingly. Conclusion of this video is most of the patients would always need second session. But well, when do you need the second session is a moot question to answer, because your expert doctor can able to help you depending on your age, depending on your baldness, depending on your scalp size, depending on your donor availability, depending on your goals. These are the 5 factors that will definitely to be considered when you talk about second transplant. Without knowing all these parameters and needs and goals, if you plan for a second session because you have no time, because of having a time constraint, if you plan your second session next day, thinking that why can't I do all these grafts in single go, I'm sure you're going to end up in donor damage as well as the only one result, whatever you achieve, that is a final. You don't get a chance to get it corrected later on, because a whole lot of story depends on only with graft number and graft availability. Because of this reason, transplantation second session should be only considered after 6 months minimum gap or later. Of course, well, in exclusions like imagine you really want to get it done beard transplant there is an exception that you can do second day. Imagine there is a huge lot number, good donors available, more than 5-6,000 available in the backside scalp donor. You can do second day transplant and get more implants in a single day. Well, however, it's always better to have a session within safe donor limit and plan it when it is necessary. Only after minimum gap of 6 months would give you more better camouflage, better results, and better outlook for you. Thank you.